just see the picture below one, and this is the orbital plate, and on the anterolateral aspect of orbital plate behind the supraorbital part margin there is a fossa, which is known as lacrimal fossa here, and lacrimal gland lie in this fossa. And if you see anterior to the anteromedial wall of the roof of frontal roof of orbit, here there is a fossa or spine present, which is known as trochlear fossa or trochlear spine, in which fibrocartilaginous pulley of superior oblique muscle is attached. So there are two important fossa are present in the orbit. In the anterolateral aspect, lacrimal fossa, and the anteromedian aspect, trochlear fossa, trochlear spine. Now see the supraorbital margin. Between the junction of lateral 2/3 and medial 1/3, you get a notch or foramen, which is known as supraorbital foramen, or if it is a notch, it is called supraorbital notch. And through this foramen or notch, supraorbital nerve and vessels passes. And just medial to this foramen or notch, you are getting the another notch, which is known as supratrochlear notch, just above the this trochlear fossa. Here you are getting the supratrochlear notch through which the supratrochlear nerve and vessels passes. So now you are seeing the internal surface of the squamous part of frontal bone, and below you are seeing the cerebral surface of orbital plate. These are cerebral surface of orbital plate, and you are seeing the many impression of sulci and gyri of frontal lobe of brain. And in the midline in the upper part you will see the sulcus. This sulcus lodges the superior sagittal sinus. Below this sulcus converted into the crest-like structure. This crest is known as frontal crest. This is frontal crest, and below there is a notch present. When ethmoidal bone is articulated with in ethmoidal notch, then this notch converted into the foramen cecum. I will show you. So this is the frontal crest, and between the frontal crest and this is the ethmoid bone, you are seeing a foramen. This is foramen cecum. So generally in adult life it is closed, but during early childhood period it is patent, and the veins are, there is a connecting vein present between the nasal mucosa and the superior sagittal sinus, which passes through the foramen cecum. These are the impression of sulci and gyri of the cerebral surface of the orbital plates. So here we are seeing the zygomatic process of frontal bone, and this is the posterior border, and temporal lines start with the posterior border of the zygomatic process of frontal bone. This is the superior temporal line start with the posterior border of zygomatic process of frontal bone. This is superior temporal line and inferior temporal line, and this is the temporal surface, and this is the frontal surface of a squamous part of temporal bone. Temporal bone articulates posteriorly with the parietal bone, you are seeing here, and in the temporal surface it articulates with the greater wing of sphenoid bone. So it articulates posteriorly with the parietal bone and then articulates with the greater wing of sphenoid bone, and zygomatic process articulates with the frontal process of zygomatic bone. This is anteriorly frontal bone articulates with nasal bone, frontal process of maxilla, lacrimal bone, and posteriorly ethmoid bone, and we go more posteriorly than the lesser wing of sphenoid bone. I will see you. So this is the posterior border of orbital plates, which articulate with the anterior border of lesser wing of sphenoid bone, and this is ethmoid bone, which is present in the ethmoidal notch. I think this is all about the frontal bone. Thank you.